All right, welcome back. It's time for us to get into a conversation this morning on the health segment, and we're going to be talking about breast reconstruction. You know, of course, this month is a very important month. Breast cancer awareness, we're having conversations all month long. And today the conversation is going to be about breast reconstruction. And we've been joined by a consultant plastic surgeon from the Kolebu Teaching Hospital. And he's going to help us to get into this conversation. Dr. Kwame Dako is our guest this morning. Doc, how are you?
Very well, thank you.
Welcome to Breakfast Daily.
Thank you, and thanks for having me, and good morning to all your viewers as well.
All right. Yeah, now let's get right into it.
Yes.
Okay.
Why would anyone need breast reconstruction?
Okay.
You can start from there.
So, the breast is an integral part of any woman's body. It's something, whether big or small, she would want it to be present. Unfortunately, breast cancer is one of the major cancers that affects women and takes quite a toll on not just their body, but on their mind as well. The aim of breast cancer treatment these days is not just to treat the disease itself, but to treat a whole human being. And the reconstructive part is an integral section of this treatment worldwide. So fortunately, over here in Ghana too, we are able to give you the whole treatment right from the beginning, be it surgery, be it chemotherapy, be it radiotherapy, to reconstruction, as well as counseling in all these aspects as well.
Now, reconstruction sounds like a very big English word. Let's now decode it. When we say breast reconstruction, what exactly do we mean here?
So breast reconstruction basically means creating a breast mound, a new one, since the old ones be taken away, or in some cases where we take only parts of the breast, we like to fill it up to try and make it look as normal as possible. The key words here being as normal as possible. There is no way we can create something brand new just like the regular one, but we try and make it as similar as possible. Sisters and not twins.
Right, so if we have to reconstruct, how is that going to be like now after the reconstruction? Am I going to be able to feel it like skin? Is it going to be like maybe I had something there, but when I wear my clothes, it will look like, you know, my breast is there? So what exactly will that be like?
So there are different ways of doing breast reconstruction. So it depends on which type we're doing. Okay. So there is some people who do not bother with any form of breast reconstruction, but use something called a breast form. Now, breast form is a mold that you simply put in your bra, that once you dress up, it looks like everything's there. If you take off your bra, then obviously one side would appear flatter than the other. So depending on which type of breast reconstruction, where we could use part of your body tissue, times we use implants, the feelings are different, the sensations are different, as well as whether or not we take the nipple with the breast or we leave the nipple in place. So that you get a whole range of different feelings depending on which type we do.
Okay, so you brought some things here today. What are we looking at?
So you're looking at breast implants, different types of breast implants.
Can I touch it?
Oh, feel free. I think you can touch it harder than that and actually give it a good squeeze, because I want to demonstrate something really as hard as possible, as hard as you think you can squeeze it. I think you can do better than that. A really good squeeze.
I'm scared.
Don't be afraid.
Something.
Don't be afraid. I mean, I'll give you an example for it.
You want to go and squeeze?
Yeah, I want to squeeze.
So people ask the question of what if this thing bursts? What if it ruptures? What if I'm in a flight and all of a sudden
your breast is all over the place?
It is a mechanical device, and it is possible for it to fail by failing, rupture, and leak. But imagine it being squeezed to this extent and it's not rupturing at all.
And
check
the
small one. Yours. I want the big ones.
All right. I mean, this is a glass table. Otherwise, I would have put it on the table and smashed
pounded it.
Yes.
Oh wow! Look at that.
Okay. So
my fingers are almost touching each other on the other side.
Exactly. So these are breast implants. These are silicone breast implants. So there are different types of silicone used for this. There's a type that's used to make the shell around, and a different type of silicone inside. Okay. Now what you are holding, or what's in front of you, is something called a tissue expander.
Okay.
So in some cases of breast cancer where they take away skin as well as the breast tissue, we need to expand the skin to be able to put in a reasonably sized breast implant. So we do that by putting in something like this, which is called a tissue expander, which gradually stretches the skin before we take this out and put in the permanent implant.
What are some of the images we are seeing on the screen? What are we looking at?
Okay, so this is a little video that was done by one of my colleagues, Dr. Levi Enkra, where, sorry, excuse me, where we have different types of breast reconstruction, where different parts of the tissue, the body was used to fill up or reconstruct the breast.
Okay.
It's running a bit fast, but what you're seeing now is the woman on the right with a tissue expander, what you're holding, and then on the left, the final. Now this...
Okay.
Yes, so this is the final. It does look a bit tight, but with time it settles down and relaxes like the regular breast.
Okay.
But that on the right is a tissue expander. Currently, what you're seeing on the screen...
What came before
yes,
this?
so this is this lady has breast cancer on the right side, and the left is the normal breast. Once they take away the breast tissue and we use an implant to reconstruct, it won't be as big as the regular breast. So we also reduce the size of the regular breast a bit. So on the right, the one without the nipple is the reconstructed breast, and the one on the left is a reduced breast.
Okay.
So
this lady is yet to come back. We can also do a nipple reconstruction for her.
I was going to ask.
Yes.
So okay. So you do the nipple reconstruct. Can I feel?
So it will feel like skin. It will not.
I won't get feelings.
You will not get extra sensations. No.
Okay.
You will not.
Okay.
That's a downside to it. But then.
But at least you have breasts,
exactly.
you know.
Once you undress and have a look at yourself, it tends to take away the memory of what you've been through and gives you some resemblance of normalcy.
There are no side effects and no complications.
Well, there are side effects and complications with everything, even drinking too much water. But then, in as much as possible, we make the treatment and the type of breast reconstruction towards your body type, and to make sure that we have as few as possible complications. Okay. In some cases, and which does sometimes happen, it's not even advisable to do breast reconstruction for someone. So we just do not do it.
At what point is it not advisable?
Especially when someone has an advanced disease. The breast cancer has gone to a very extensive stage and is spread in different parts of the body. We tend not to want to do it. To put the person under extra surgery, longer surgery and things like that, we tend to shy away from that.
Okay.
And there is also an option of having your breast cancer treatment done first before coming back to have the reconstruction done. And in some cases, we do both at the same time. It all depends on the stage and the type of breast cancer that you have.
So at what stage can an implant be done for you, or like reconstruction be done for you?
So it can be done at both stages, like I said. It can be done immediately during when the breast is taken off. By the time you wake up, you have a new one already there.
Okay.
Or it can be done at a later date, where after we've treated the breast cancer, we've gone through all forms of treatment, be it chemo, be it radiation, then we do the reconstruction for you. And bear in mind, reconstruction does not necessarily mean we're using an implant. We can use different parts of the body.
Okay.
So sometimes we can use the back muscle, which is what we saw on one of the pictures. Or we can also use your tummy. We can use your tummy as well to create a new breast. Or in some cases where the cancer is small, just like the one that's on the screen now, we are able to remove parts, and I'm able to readjust parts of the remaining breast tissue to make it look normal. So if we able to, yes. So the previous picture was the lady, and this is just her own tissue. We've not used any implants. We've not used any other part of the body. We've just managed to mold it together to make it look normal.
So, okay, so now when you use other parts of the body, you still won't get the sensation?
You would not get the same sensation, unfortunately, no.
Not even small?
You get a skin sensation, but that's
maybe if you can get some small, I can manage with that,
yeah. Well, I guess if you're doing reconstruction, we haven't reached a point where we can create the nerve sensations the same way they were before.
You will get nerve sensation, but not the same as before. It's like even on any other part of your body where you have an old scar, you realize the sensation over the scar, and sometimes just around the scar is not the same as an unscathed part of your body. Yes.
Is it very expensive to do this? reconstruction?
Well, in today's Ghana, expensive is relative, but it's a bit more than the regular mastectomy, like taking off your breast, because it takes a bit more time in theater. If you're able to do it, if you're the right candidate for us to do it at the same time, and the cost doesn't vary too much because it's the same surgery, it just takes a bit longer. As against when you have to go home and then come back later for brand new surgery, then it goes up a bit.
So like how much are we looking at? Not like specifics, but maybe if you've suffered breast cancer, if your breast has been removed, if you have maybe between this and that, you can undergo this and can have your life back.
Well, the range is wide. So I would have said anywhere from 5,000 Ghana cedis all the way up to 25,000 Ghana cedis in Kolibu Teaching Hospital.
I mean, if you can get your life back, your confidence back and all.
Well, like I said,
I get you, because sometimes when you hear things like this, it's like a whole new part of your body being created again. It comes like this is going to be huge. It cannot be, you can't afford it. But I'm sure there are people who do not have this understanding, and so are dealing with, the trauma that comes with it and all the issues.
Well, you're right, it's not too bad, and actually it's being done on a regular basis. So week in, week out, we're doing...
Oh, wow, so we have a lot of people coming in.
Yes, that's right. So all the pictures you've seen are patients we've done in Kolibu Teaching Hospital.
I was actually going to ask you something. I mean, when you hear plastic surgery, a lot of people think of it in terms of the cosmetics, aesthetics, as opposed to medically fixing a problem, and doing it because it's necessary to do, and not necessarily just for fanciful, body aesthetics. Talk to us a little bit about, the importance of plastic surgery as a medical practice.
So plastic surgeons all over the world are described as the surgeon's surgeon. So whenever a surgeon has a big complex procedure to do and knows that I'm going to have problems with some particular part or doing some closing up of some sort, they tend to fall back on the plastic surgeons. So what we tend to do is to mold the body somehow, take parts of the body from one place or the other, and are able to close the defect or try and make it look as normal as possible. So that's what we tend to do. And we work from anywhere from the scalp to the face, the chest, the back, the arms, the wrists, hand, legs, pelvis, everywhere, every part of the body we're there. The range of our work spans from children with congenital disorders such as cleft lip and palate, fused fingers, extra digits. We do all of that. To burns patients, to those who are involved in trauma accidents, those who slit their wrists or sometimes parts of their body are even cut off, and if they come in time and package properly, we're able to fix them back.
You're next to God.
No, quite. No. To breast cancers we're talking about, to other cancers. We also work closely with orthopedic surgeons when you have some form of fracture with skin loss, and once the bone is fixed, there's still a big hole in your leg. We would be able to bring some parts of the body and use it to patch the area, and at the same time close up where we've taken it from. So we rob Peter to pay Paul, but only when they can afford it.
But let's look at cosmetics-wise these days. Now a lot of people feel once I can afford it and I don't like my body, I can go to the hospital, something can be done for me. Is it safe? Is it advisable that if you don't have any health issues, you just walk in to say that, okay, I want bigger boobs, so do something about it for me, or I want to do liposuction, I want to have a smaller waist and all that. Is it safe, or there will be implications later on? So if you really don't have any health problems, just keep your body.
It's a very personal decision, I must say from the beginning. But then if you go to a well-qualified and appropriate person, they would not take you off the streets and just send you into theater and do whatever they have to do for you. There are a number of checks and investigations we do even before we'd want to touch you for regular surgery, how much more cosmetic surgery. So we check your heart, your lungs, your blood levels, a few other things, and even we've taken a psychological assessment. The mere chat we're talking, the consultation we're having with you is a psychological assessment. In some cases, you realize the person's ideology and thoughts of what they're going to get or what you're going to do for them are totally off. In that case, it's best not to even go there.
Okay.
Because it's not just about your physical well-being, but also your mental well-being. Okay, and it surprises you that a lot of women come for these kind of procedures for their mental well-being. They become new people.
Yeah.
I mean, I've had a few people tell me that thanks for giving my wife back to me, because after kids, 3-4 kids, body changed,
And it affected her
her
mental.
behavior
I
had
get
changed.
it, yes.
And once she'd had a few things done to her, she became her old self again, bubbly self again, yes.
Wow. Please, yeah, go ahead.
Okay, don't worry. I have all the questions, because I mean this is more like for women, in now. So, for instance, if you advising me as a doctor, okay, would you say that if you have the money, go for it? And if you're advising me as a sister, would you say that you don't really need this?
Well, it depends on the reason you're going for it.
Purely cosmetics,
Well,
It's
cosmetics.
not like maybe I've given birth and your body is entirely out of shape. I feel that, okay, so I want to be able to wear bikinis, I want to be able to wear crop tops, and these are my reasons, And I'm asking this because of the many conversations around this on social media and what people are looking up to, for instance, celebrities do, and how young women, are now beginning to fall for these things. That's why I said advising as a doctor and advising me as a sister.
Okay, so do you want me to separate the two? Or?
Yes, no, I want
Okay.
you to separate the two. That if you're advising me as a doctor, what would it be? And I have my money.
Well, like I said, we have to check to see if the indications are right.
Yeah.
We've had a gentleman come to us and say, I don't like my nose, I want you to change my nose. We'd ask, so which
In
aspects
Ghana?
in Ghana, yes.
Wow.
We asked what aspects of your nose don't you like?
Yeah.
And said, oh, it's just too big, and he wants to make sure his kids don't get this nose.
But
Obviously,
that won't help in any way.
yes, exactly. So obviously, this person's head is not in the right place,
Yeah.
and you don't want to be involved with this, and obviously, you wouldn't go in that
Because
direction.
they will come after you if their children have the same nose.
Exactly. So, in such a case, it's not going to happen, irrespective of how much money they have.
Okay.
Okay. As a sister, it depends on what you want done, and if it's the right indication. Once again, you feel that, well, this is a bother to me all the time. There are women who there's nothing physically wrong with them as far as we're concerned, but they tell us that every wedding they go for, they avoid the pictures because they don't want to be seen in that way, and it's a bother on their mind.
Wow.
We'd go ahead and do that for them, and it does change them as a person.
Interesting.
Yeah, wow.
Quickly run us through what any woman that has just discovered that she has breast cancer, regardless of the stage, and is considering some kind of procedure, in terms of reconstruction, either now or post treatments.
Okay.
What should they consider?
Okay, so first of all, I'd just like to reiterate that the key to breast cancer treatment is early detection. So the self-breast examinations are key. Immediately you think there's something off, see your doctor. If they do find a lump and we have to take a biopsy or whatever it is, we do so early and then initiate treatment for cure. If they do want some form of breast reconstruction, it's important they mention it to their surgeon when they see them for the first time, so that we plan together and see your options and see what is appropriate. If you've already had a mastectomy done, that's fine. You can still come and see us, and then we'd assess you, see the various options that are available, and see what is safe for you, and then we'd proceed with our workup.
Fantastic.
Okay. Now, when reconstruction is done, can I just go about my normal duties? Can somebody touch it? Or I have to be very careful. There are certain things I need to do, certain things I can't do. What are the indications here?
So, well, in the early stages, it's a surgical wound,
Yeah.
and we'd want it to heal fully. Once it heals, you continue with your normal life. An interesting story I can tell you is of I think she was 25 or 26 at the time. She just finished university. She was a national service person, and they discovered, she was still living with her parents, and they discovered a lump. Investigations was done, and it was confirmed it was breast cancer. She was with the general surgeons and informed us that she also wanted some form of breast reconstruction, being that she was single, no children, and wanted to try and get her life back to as normal as possible. We did the full gamut of investigations, treatments, reconstruction with a breast implant. I think she came back earlier this year for a nipple reconstruction, and then she sent me a picture a few weeks back that she's now married. And is looking forward to the day she'll have children.
Wow.
So
But you can't breastfeed.
you can't breastfeed from that particular breast, but from the other one. So the point I'm trying to make here is that you live a very normal life. If
And
you
Mr.
have
Dapo
early
can hold
detection,
it. I mean, no issues.
that's the point I'm making. She's getting married, so obviously.
No, after the marriage, you can get married, but you know, this is a no-go area and all that. That's what I'm asking.
It's not a no-go area.
Okay.
That's the demonstration we gave with
So
you
it can-
squeezing and
okay.
holding. All right?
Okay.
But the key, like I said, is early detection
detection.
and seek medical attention as soon as possible.
Okay. Now you can have the two. Dr. Dapo, thank you very much. We've been educated.
It's been my pleasure, and thank you for having me.
Right. So this is it, you know. So if you have breast cancer, and in fact, if you have to go through mastectomy and all that, just know that all hope is not lost, you know. But early detection saves us all from this conversation and going under the knife and all that and that. But if you are at a stage where you have to go under the knife, if you are at a stage where you've done that already, you can have your life back, you know, and your confidence back. Just be you by going. And if the beautiful thing about this is it is done right here. You know, I know that as for Kolebu Lorifedia, we have. You know, so it can be done. Doctor, thank you very much for this.
So it's the National Plastic Surgeon.
So it's a National Reconstructive Plastic Surgery and Burn Center.
Center.
And we worked hand in hand with the surgeons, in the general surgeons in Kolebu, and in a few other hospitals as well, where we move around.
Okay, fantastic. I'd love to Dr. Ampoma.
Sure, definitely. See you.
All right.
Yes.
I'll call you later. Kwame Daz is looking at me, but I don't mind it.
We'll take a quick break. Don't go anywhere. We'll be right back.